Hello everyone. Today we are going to learn mammalian dentition, the arrangement or condition of the teeth in a particular individual or a species is called dentition. In today's lecture, we will particularly discuss about dentition of mammals. These are some important terms: acrodont, polydont, thecodont, homodont and heterodont. These are the different terms for dentition. Acrodont is a formation of teeth whereby the teeth are consolidated with the summit of the alveolar ridge of the jaw without sockets. The examples are some lizards and sphinodont. The polyphyrodont means no socket and teeth rest in a dental groove with a high labial wall and a low lingual wall. Examples are varanid and linguanid lizards. Thecodont means teeth are arranged in sockets. Homodont means teeth are of same shape. Examples are non-mammalian vertebrates. And heterodont means teeth are of different types like incisor, canine, premolar and molar. All the mammals are having this type of dental formula or dental arrangement. This is the structure of tooth. The outermost layer is known as enamel. It is the hardest walled tissue covering the surface of the dental crown. It is as hard as crystal. The next layer is called as dentin, the tissue that forms the tooth from the dental crown to the tooth root situated inside the enamel and cementum. It is softer than the enamel. A small tube filled with tissue fluid called the dential tubule runs inside the dentin. The next is cementum, the tissue covering the surface of the tooth root. It connects the alveolar bone with the tooth by the periodontal ligament. Its hardness is similar to the bone. Next is pulp cavity. The dental pulp means the tissue is called the nerve. Blood vessels and the lymph vessels as well as nerve fibers are located in the dental pulp, supplying nutrients to the dentin. Alveolar bone is the next one, the jaw bone supporting the tooth. The tooth is planted into this bone. When a large part of the alveolar bone is destroyed by periodontal disease or other causes, the tooth becomes loose. The next is gingiva. The soft tissue covering the alveolar bone is known as gingiva, or generally it is called as gum. Gingival sulcus, the small space between the tooth and the gum. Even people with healthy teeth usually have a depth of 1 to 2 mm in this space. When this space deepens due to inflammation, it is called the periodontal pocket or gingival pocket. So this is the structure of tooth. This is the diagram of elephant tooth, which has core, dentin, cementum and gum line. Next is tooth attachment. Thecodont teeth have roots that are sunk deep into the bone and are thus more firmly attached. Acrodont teeth are set flat on the surface of the jaw. Pleurodont teeth are attached to the medial or lingual side of the jaw. These are the different types of tooth shapes, and these shapes are depend on the diet. Fish eaters, they have long, conical, pointed, straight teeth to pierce in slippery prey. Carnivores having several types of specializations. They have large triangular teeth that are laterally compressed, may have sharp serrated edges, hold or slice the meat. Omnivores, their teeth are simple, short cusps that crush seeds or grind plant material and still handle some other food. Herbivores' teeth are tiny with minutely serrated edges, flat topped teeth, crowns longer than the roots. Tooth replacement. Elasmobranch fishes have continuous replacement of teeth. Most mammals have only two sets of teeth. Deciduous means milk teeth and permanent teeth. Toothed whale with only one set of teeth during their entire lifetime. Incisors of rodents are ever growing means continuously growing. The mammalian dentition. The types depend on the shape. There are four types of mammalian teeth: incisor, canines, premolars, and molars. Incisors are often the first adult teeth that grow in after our primary teeth or baby teeth and make up most of our smile. There are 8 incisors in the mouth, 4 in the top center and of our mouth and the 4 in the bottom center. These teeth are thin, flat bottom teeth that help us to make the initial bite on our food. We bite into food with our incisors, tugging and pulling into our mouth. Incisors have a narrow edge and are adapted for cutting. The incisors are situated between the canines and are often referred to as anterior teeth or front teeth. The next type is canines. Canines are the closest link between the human mouth and that of a carnivorous predator, like a tiger or wolf. These are sharp, pointed teeth on either side of our incisors that are used to do exactly what they look like. They are meant to do tear into food and rip it apart. The next type is premolars and molars. Premolars are our first molar teeth that tend to come in around 12 or 13 years of age. Premolars sit next to the molar in the mouth and are the foremost molar in the mouth. Molars are the teeth we most commonly associate with chewing, while many only recognize 3 types of teeth rather than 5. The discrepancy comes in distinguishing between different types of molars. Molars are simply large teeth with a flatter surface that are used to chew food into small, easily consumable pieces. Here is the dental formula. The dental formula are accordingly the incisor, canine, premolar, and molar. So, general mammalian dental formula is 3 1 4 3. The 22 teeth on the upper jaw and 22 teeth are in lower jaw. Marsupials dental formula is 5 1 3 4, means 5 incisor, 1 canine, 3 premolar, and 4 molar. Pig, human, and other have 2 1 2 3, total 32 teeth. The elephant tusks are formed by the upper incisor teeth. They lost their enamel and pure dentin. This is the table which shows the dental formula of common mammalian genus like Didelphis, Ursus, Canis, Vulpes, etc. So there are so many different types of dental formula we can see in this table. Human dentition, this is the pie chart showing percentage of each type of teeth in human. Among the 100% of total teeth, 25% are incisors, 12% are canines, 25% premolar and 38% molar, means we have maximum molar teeth. So this is all about dentition. Thank you.